Hello everyone, this is the part 2 of vitamin D3 in erythropoiesis. That is where we were understanding the role of vitamin D3 in ferrium D3. So anti-inflammatory properties is what I wanted to discuss in this particular video. So what happens exactly in inflammation? Why anemia occurs in inflammation? So whenever there is an inflammation, a lot of cytokines are produced. Some of the key cytokines which are produced are interleukin 6, interleukin 1 beta. These are the prime cytokines which can impair erythropoiesis. So erythropoiesis will get disturbed whenever these cytokines are present in higher quantities in the blood. So that is what is going to happen in inflammation. Now the question is, how is the human body going to react to this particular situation? A human body, it produces peptide hormones by the name hepcidin, which is going to combat against this inflammation. So what exactly is this hepcidin? Hepcidin is an inflammatory peptide or a peptide hormone. It has also got antimicrobial properties. So who is it or why it is being produced? It is the human body, our own body, it produces hepcidin as a protective response. As the name itself indicates, it's hepcidin produced from the liver. So it is produced whenever the body encounters any infecting organisms or when there is an inflammation. That is when the hepcidin produces, the hepcidin is produced by the liver. So when is it produced? Whenever the body senses that there are a lot of cytokines like interleukin 6, that is when hepcidin is produced. What is the mechanism by which hepcidin is going to help us? No, hepcidin is going to control this inflammation by restricting the supply of iron, and this restriction of iron is possible by blockade of ferroportin receptors. Now these ferroportin receptors or the channels are present on various cells like your intestinal cells, the macrophages, the reticuloendothelial system. Now these ferroportin, they regulate the entry of iron from the cells into the blood plasma. So if these ferroportin receptors are blocked due to any reason, then these iron from the cells will not go inside the plasma. So iron will start accumulating inside the cells itself. So this is what hepcidin will do, and it will restrict the iron availability to the microorganism, which is essential for the growth of the microorganism. So therefore that supply is blocked, the organisms will not grow. The inflammation also requires this iron. So to reduce the inflammation, iron supply is blocked. That is what hepcidin does. So this is all the good thing what hepcidin is going to do, but unfortunately it carries certain disadvantages. When it blocks the ferroportin receptors on the cells, the iron availability for the erythropoiesis also gets blocked. So the iron supply to the bone marrow is blocked, as a result of which the erythropoiesis is now disturbed. This is what happens in inflammation. So when in the backdrop of inflammation, the anemia becomes even more severe because iron is not going towards erythropoiesis or towards the bone marrow. So what hepcidin does in the inflammation, whether it is an acute or chronic inflammation, what it does is reduces the absorption of iron, because it is trying to block the supply of iron to the inflammatory cytokines. It blocks the supply of iron to the growing microorganisms. So therefore it prevents iron recycling, but unfortunately, as a result of which there is a disadvantage. Iron is not even reaching to the bone marrow, and therefore erythropoiesis is getting disturbed. So what happens in chronic inflammation? Because of a long period of time, the iron is not going into the blood, into the plasma, it is staying inside the cells. So the cellular concentration of the iron increases. The cells are having a lot of iron, but that is not going for erythropoiesis. So I call this situation as scarcity amidst plenty. Now imagine a person, he is very thirsty, but unfortunately if he is stuck at a sea where there is a lot of water, but he cannot drink seawater, because seawater, we all know that it is having a lot of salts. So because of the presence of lot of salt, you cannot drink that water. It is not a potable water. So there is an ocean but still you cannot quench your thirst. This is what is called as scarcity amidst plenty. This is a similar situation. A lot of iron is deposited inside the cells, but that is not traveling or going to the bone marrow through the blood, because your ferroportin channels or the receptors are blocked because of hepcidin. So most of the physicians, what they try to do is they try to give a lot of iron rich food like meat, green leafy vegetables, or iron supplements also, but still the hemoglobin levels are not getting rectified. So the doctors, they usually ask, I have prescribed your product, but still the patient is still anemic, the hemoglobin is not rising, probably your product is not working. But that is not the situation. This particular patient requires an additional support. Just giving iron is not sufficient. You have to give an additional substance which can combat or which can fight this situation, and in that your vitamin D3 is going to help by making the erythropoiesis more efficient or more effective. So let us see how this vitamin D3 is going to do wonders, or how it is going to help in this particular inflammation backdrop. So vitamin D, it has got immunomodulatory or anti-inflammatory properties. What it does is it modulates the hepcidin ferroportin actions. I will show in my subsequent slide where I have used an image or a picture where I will explain to you how this axis is going to be regulated. So it has got a dose dependent action. So as you increase the dose of vitamin D, it produces more and more anti-inflammatory properties. It decreases the levels of the inflammatory cytokines like your interleukin 6 or interleukin 1 beta. It reduces the hepcidin levels by reducing its expression on the mRNA. So hepcidin levels are reduced. It increases the ferroportin mRNA expression. So what it does is it creates new ferroportin channels, or it overcomes the block of the ferroportin which is produced by the hepcidin. So all in all, the direct action which I was mentioning earlier in my previous video, it stimulates the erythroid precursors, it synergizes the erythropoietin actions, and indirectly it modulates the inflammatory cytokine production. It reduces the inflammatory environment, and it reduces the hepcidin levels, and it increases the ferroportin expression. So this is an good pictorial representation of what is happening in conditions where inflammation is there, how this iron is restricted for erythropoiesis. Now whenever there is inflammation, the liver produces hepcidin. Now this hepcidin is going to block the ferroportin channels or ferroportin receptor. As I was mentioning earlier, these ferroportin receptors are present on the intestinal cells. These are located on the reticuloendothelial system. These are located on various cells. Now when these ferroportin receptors are blocked, though the iron is absorbed by the intestinal cells, the enterocytes, but they cannot get inside the blood or inside the plasma, because that is what is required, right? Your iron should come out into the plasma. The moment it enters into the blood or plasma, it binds to transferrin, and transferrin will take it to the bone marrow for erythropoiesis. But that is what is not happening. Iron is absorbed by the cells, but now it is not going inside the plasma. And similarly, the iron from the old RBCs, when they get destroyed inside the spleen, we call the spleen as a graveyard, right? So the iron from the old dead RBCs have to be again reutilized. This is called as the recycling of the iron. Even that is also blocked because of hepcidin. So what you have to do, you have to reduce the hepcidin expression, or you have to increase the ferroportin receptors. So number of ferroportin receptors, either it should increase or you have to overcome this blockade. So vitamin D3 regulates the hepcidin ferroportin axis and make sure that this block of ferroportin is overcome. This is again a flow chart. This is a traditional role of vitamin D3. It increases calcium absorption. We all know about it. But the new role about vitamin D3 is it reduces the hepcidin levels, it reduces the inflammation, it increases the ferroportin expression also, which is not mentioned over here, and therefore it reduces anemia, especially the anemia in the backdrop of inflammation. Again, another depiction, vitamin D3 binds to its receptors, that is a direct role, and therefore it stimulates erythroid precursors. On the other hand, the indirect role, it reduces the inflammation, it increases the survival of the RBCs, therefore the erythropoiesis becomes more efficient and more effective, and therefore it reduces the anemia risk, especially in those individuals who are having a high propensity of developing inflammation or infection. That is when this vitamin D3 along with iron is going to help in making erythropoiesis more effective. So a lot of clinical studies are there to evaluate how exactly vitamin D helps, or what we are speaking is right, or is this just only a plain hypothesis which is not supported by any studies. So there is one epidemiological study which evaluated 554 patients. It was found that anemia was even high in those population which were having D deficiency. So 48% anemia was found in those individuals who were also having vitamin D deficiency, whereas anemia was 36% in those people who had normal vitamin D levels. So this shows that vitamin D has got some role in erythropoiesis. Another clinical study, there was a fortified food which was given, which was fortified with vitamin D, that was given along with iron in one group. In another group there was only iron which was given. So this is a randomized placebo controlled double blind trial. So it was found that the group which received additional vitamin D levels, they had higher levels of hematocrit, they had better hemoglobin levels, the value of erythrocytes were higher, statistically it was significant, and it was better than the other group. So it was believed that the fortified food products which were having vitamin D, that will help in getting a better erythropoiesis. We don't have fortified products. In India it is very difficult to find, only few products would be there. So therefore vitamin D3 along with ferrous ascorbate is going to help in making the erythropoiesis more effective and more efficient. So with this I will conclude my presentation, and I request you to go through these video presentation. If you have any doubt, you can write a mail to me or to the medical team on MQuest, that is the portal where we answer to all your queries. So thank you, colleagues.